Are all plastic surgeons doing this or just you?
Definitely not all are doing it, but I'm sure hopefully many of us and most of us are doing it this way. But you know, there are so many things that differentiate surgeons and their techniques. There's so many, I just mentioned a few, but there's 100 different items or more involved in every operation, and they're gonna vary between surgeons. So, you know, choose wisely with your surgeons. I've been involved with FDA clinical studies for 2 of the 3 big silicone gel implant manufacturers in the US, and to me, I think that is an indication that the manufacturers believe I have a very low complication rate in my operations, and I think that's true. Nobody's going to have a 0 rate, but we want to be as close to that as possible. And you want to make sure you go to somebody who's good, who's going to do it the right way and not cut corners to help minimize your chances of having a problem.
So for everyone that's watching, are there people that are more prone to these issues of needing a revision? Like, can you kind of see a body type that's a little bit more prone, or maybe a background that's a little bit more prone to it?
I think that one key thing that we see is if somebody goes really big on their implants, I think that that's going to increase their risk. There's more stress on the tissues. I think that if they are super active after surgery and get some bleeding around the implant, I think that can be a trigger. And sometimes although I've done this to many professional athletes, I think that I have seen in some cases where people are vigorously working out their chest muscles. I think kind of like pulling a muscle in the pectoralis major area can sometimes trigger a breast implant capsular contracture as well.
Interesting. I hope none of these ever happen very often.
Well, you know, things can happen, but at least we're aware of these risks, so patients can counteract all of them by making wise decisions.
Yeah, and to go to the right professional. I feel like that's key.
Do it right the first time.
Totally.